What is testosterone? Testosterone is a hormone primarily produced in the testicles in males and in smaller amounts in the ovaries in females. It belongs to a class of hormones called androgens. In males, testosterone plays a crucial role in the development of male reproductive tissues, such as the testes and prostate. What is testosterone in males? What is testosterone in female? Testosterone is a hormone that is present in both males and females, but it's typically associated with males due to higher levels. In males, testosterone is primarily produced in the testes and is responsible for the development of male reproductive tissues and secondary sexual characteristics and sperm production. In females, testosterone is produced in the ovaries and adrenal glands, albeit in much smaller amounts compared to males. Function of testosterone in body? Testosterone, a crucial hormone in both males and females, serves multiple vital roles in the body. 1. Sexual development. It guides the development of primary sexual characteristics, like testes and ovaries, as well as secondary sexual characteristics, such as facial hair in men and body curves in women. 2. Libido and sexual function. Testosterone regulates sexual desire and function, contributing to healthy sexual performance. 3. Bone health. It helps maintain bone density, reducing the risk of osteoporosis and fractures, particularly in men. 4. Muscle mass and strength. Testosterone promotes muscle growth and strength, enhancing physical performance. 5. Mood and well-being. Testosterone levels affect mood, energy levels, and overall mental well-being. 6. Cognitive function. While not fully understood, testosterone may play a role in cognitive functions such as memory and spatial abilities. 7. Red blood cell production. It stimulates the production of red blood cells, aiding in oxygen transport and overall vitality. Why testosterone is important? Testosterone plays a key role in libido, sex drive, and sexual performance, ensuring healthy sexual function. It promotes muscle growth and strength, helping to maintain muscle mass. Testosterone may have an impact on cognitive functions such as memory and spatial abilities. Testosterone stimulates the production of red blood cells, which are essential for oxygen transport in the body and overall vitality. Testosterone is essential for sexual health, muscle strength, bone density, mood regulation, and overall well-being in both men and women. Symptoms. 1. Low libido. Decreased sex drive or reduced interest in sexual activity is a hallmark symptom of low testosterone levels. 2. Erectile dysfunction. Men with low testosterone levels may experience difficulty achieving or maintaining erections during sexual activity. 3. Fatigue. Persistent feelings of tiredness, low energy levels, and reduced motivation are common symptoms. 4. Loss of muscle mass. Testosterone is essential for maintaining muscle mass and strength. Low levels can lead to muscle weakness and decreased muscle bulk. 5. Increased body fat. Low testosterone levels can cause an increase in body fat, particularly around the abdomen. 6. Decreased bone density. Testosterone helps maintain bone density. Low levels can increase the risk of osteoporosis and fractures. 7. Mood changes. Symptoms such as irritability, mood swings, depression, and decreased sense of well-being may occur. 8. Cognitive changes. Some individuals may experience difficulties with memory, concentration, and cognitive function. 9. Decreased facial and body hair. In men, low testosterone levels can lead to a reduction in facial and body hair growth. 1. Lifestyle changes. Adopting a healthy lifestyle can naturally boost testosterone levels. This includes regular exercise, maintaining a healthy weight, getting adequate sleep, managing stress, and avoiding excessive alcohol consumption and smoking. 2. Dietary changes. Eating a balanced diet rich in nutrients like zinc, vitamin D, and healthy fats can support healthy testosterone levels. Foods such as lean meats, fish, eggs, nuts, seeds, fruits, and vegetables can be beneficial. 3. Testosterone replacement therapy. TRT. TRT involves administering testosterone through injections, patches, gels, or pellets to restore testosterone levels to normal. This approach is typically recommended for men with clinically low testosterone levels, hypogonadism, and significant symptoms. 4. Medications. Certain medications, such as clomiphene citrate or human chorionic gonadotropin, HG, may be prescribed to stimulate the body's natural production of testosterone. These medications are often used in cases where fertility preservation is a concern. 5. Natural supplements. Some natural supplements, such as DHEA dehydroepiandrosterone, fenugreek, ashwagandha, and Tribulus terrestris, are purported to support healthy testosterone levels. Thank you for watching. Please like, share, and subscribe my channel.